3-minute routine to fix your pelvic problem. That's the subject of this video, so stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. One of the first things that I tell my patients with pelvic floor dysfunction is the importance of breathing and the stability of the trunk. Why? Because if it is not stable, it's kind of like a dead weight over the pelvis, and the pelvis is the house that pelvic floor is the floor of. So you can have instability of pelvis that can translate into, erectile dysfunction. It can feed that problem. It can be instability of the pelvis causing pelvic pain, tailbone pain, urinary incontinence, and things like that. So I want you to start thinking in those terms. So one of the things that I strongly encourage my patients to do has to do with an actual breathing. I've done videos on breathing. We'll make sure that we put at the end of this video so you have a better understanding of it. But for now, I want you to place your hands on the side of your rib cage, and as you're breathing in through your nose, try to push your ribs outward. So not down towards the floor, but out towards the side walls. It's a little bit more difficult to do as you're breathing in. A lot of times people are able to do it as they're breathing out. So that's a good practice. Another exercise that I really like, and if it's 3 minutes, I'd like for you to divide this time between these two exercises. One is the breathing, and then the other one is laying down on your back with your spine nice and neutral, head is nicely elongated, your rib cage is not elevated. If it's elevated, you get that arch. We don't want to have any arch. So your chest is down to the floor, the small of your back is nicely touching the ground, your neck is elevated, and one leg at a time. So as I'm about to take this leg up, I'm not going to let my body to move down. So the challenge is to keep it in place as I bring my leg up. You can place your hands this way, which is challenging if your chest is lifted up. If you're not able to lay your hands flat on the ground, then put them here. But ideally, we want to have that. It's good for overall posture and stability of your trunk. And then you're going to just go toe tap. So the whole purpose of toe tapping is to stabilize the trunk. So as we're taking the legs away from the body, we're not losing the stability. So we're not going this way and that way. It's nice and stabilized. So give that a try, the toe tapping exercise, which is very important. I think a lot of times when it comes to our problems, we're looking for a quick fix, when in reality, there is no such thing as a quick fix for a big problem. When we have pelvic floor dysfunction, that is a chronic problem. So keep that in mind. You got to be realistic with what the goals are and the timeline that you give yourself. If you have any questions, please make sure you contact me using one of the methods of contact in the description box. And do know that over time, you have a much better chance of overcoming this no matter what. Hope this helped.